Welcome back to Balanced Health. It's time for Nutrition in the News. Antibiotics are commonly used to treat sinus infections, but a new study found that they work no better than a placebo. Further prescribing antibiotics to sinus patients may cause harm by increasing their resistance to the medications. Now, in the study, researchers followed about 200 patients with sinusitis. Of the 100 who received an antibiotic, 29% had symptoms that lasted for 10 days or more. Another 107 received a placebo, and 34% had similar lasting symptoms. The difference was statistically insignificant. The effectiveness of a nasal steroid spray for sinus infections was also tested in a study and found to work the same as the placebo, except among a group of patients with milder symptoms where it was slightly beneficial. Shirley and Dr. Smith, here, if you remember, not too long ago, we just did an expose, if you will, on antibiotics for ear infections.
Right.
And how the American Academy of Pediatrics has pretty much said that's no longer protocol. And at that point in time, they were pretty much emphatic of saying, but for sinus infections, it still is. Here we are, fast forward 5 or 6 months later, and they're saying, well, maybe not. I say this not to be critical, but I think it really kind of makes us wonder, doesn't it?
Well, yeah, as a person who suffers with sinusitis, and about once a year it gets like worse, and I get a secondary infection, which is a sinus infection, which you can get really sick from that. I mean, you can kind of be feverish. You don't run a high fever, but just like a low-grade temperature. You feel really sick. Your head's stuffy. You get this horrible sinus headache. And I actually have been given antibiotics for that. But isn't it true that just sinusitis can turn into a full-blown infection where you would need antibiotics or no?
I don't know about turn into, but get a secondary, animal in there that would cause some more flare-ups, and that's why a lot of times that the antibiotics are not working, because a lot of it's viral and just pus-filled stuff, and a lot of times, people need to understand that sinus right there, the maxillary sinus, doesn't drain down with gravity like the other ones do. That has the hole on the upside for drainage up.
Oh my gosh!
And
is that what gives you the horrible headaches then?
Yeah, it just fills up in the pressure. There's a lot of nerve-sensitive pieces of tissue, just like the low back, in the sinuses, and that all goes through the spinal cord, and we all interpret it as headache or head pain. The brain doesn't really know how to differentiate between the two.
Well, can chiropractic care help sinus infections? I mean, that wasn't my original question, but I'm very curious about that.
See, that's a good tie-in because in my office we see so much. Just besides adjusting people, there's other techniques you can use. I don't just say adjust the neck to help the sinus infection, but hey, how about reduce the amount of refined sugars and garbage foods that you're consuming if you have a sinus infection. Maybe minimize your exposure to the allergens for that period of time. And then if you can heat that stuff up, it's like frozen bacon grease. If you can heat it up, it becomes more liquid. And you can get that to drain out of the sinuses, and you can feel
through
a hot shower. Shower.
Yeah, that helps.
We call it just hottest shower on your face, and pound on your face a little bit just by hitting your bones. It'll start to loosen stuff up. You can leave the shower feeling like $1,000,000.
And inhale the onions and the garlic too.
Very good, Shirley. She gets an A for memory. Another thing is exercise. I exercise every morning, and without getting overly graphic here,
you shared this with us already.
Will blow my nose many, many times throughout a workout. And I just know that if I wasn't moving that stuff, because what doctors are afraid of, what most of them would tell you is that because of what you said about the maxillary sinuses, how they do drain up, that if that mucus is infected, and it's draining up towards the brain, it's draining up towards the skull. Sometimes you'll see things with kids with meningitis occurs after something like a sinus infection, where that thing remains dormant and then reactivates in the brain area. So that's what they're afraid of. A neti cup is something that I've used before, and I know Shoya's not thrilled with it. It's kind of, it's very Eastern. Things. It's very Ayurvedic.
I have had. Well, first of all, tell the viewers what it is in case they don't know.
It looks like a little genie.
Yeah.
Cup, okay.
A little pitcher or something.
And you take the water and you pour it in one, and it just irrigates. And again, without getting graphic, what comes out of the other side of you can be very alarming, but it makes all the. So I do the pot of garlic and onions and stuff like that. I put a towel over my head, steam. I do that for a few minutes, and I do a neti cup, and
I never was a swimmer. I don't like water up in my nose, and I tried this neti cup one time, and my sinuses were so stuffed it went right into my ears. Filled up my ears. I don't think I was doing it right or something.
You have to get used to it, but once you do
it,
you should use warm water with a little bit of non-iodized salt in there, and it really helps. And saline sprays are another thing. So
yes, those
our viewers need to walk away with this: is that they can, as soon as they feel it coming on, start with the saline spray and some steam, like Dr. Smith said, and
that's good.
And you can really make a difference with sinus infections.
Well, when we went to the Nutrition in the News, we were talking about discs, blown discs, ruptured discs, and this is really a bad surgery. Could you shed some light on that? When do you need surgery? Do you need surgery?
It is low back pain surgery or neck pain surgery, probably the most failed surgery for the last, I don't know how many years.
Wow.
I think it was 80% failure rate for the longest time. They've recently invented some new procedures that actually are a lot better for the body for surgery-wise. And I want to let the viewers know that I work very closely with neurologists, pain specialists, and surgeons, because basically if I can't fix them, we know that that person is going to need some extra help. Now, there's some extra procedures even between chiropractic care and full-blown surgery. There's epidural injections. There's nucleoplasties, basically where they put a needle into the disc and try and suck it back in instead of doing full-blown surgery. So just a little needle. Okay,
and a neurosurgeon would do those procedures, or do they only do the surgeries?
Pain specialist is usually the in-between guy where they get injections or some needle stuff to kind of suck the disc back in. And if that doesn't work, we can go the full surgery. But now there's a full surgery that only touches the muscles a little bit. Cuts
less invasive, right?
Very less invasive. They go with a probe instead of a knife and kind of wiggle their way to the disc, like a scoping procedure for the knee, how simple that is now. They can do that same thing for the back.
Well, that's encouraging.
But we just feel, in this show, one of the things we do is bring people information that becomes a tool for their tool chest of health, if you'll use that analogy. And one of the things we try and educate them on is, and a doctor's first Hippocratic oath is what? Do no harm.
Do no harm. Right.
So why wouldn't you go that route and see if you can get help there? And one of the reasons that people have told me that, Dr. Smith, is, well, if their HMO, if their PCP, their primary care provider, won't recommend a chiropractor, that the insurance doesn't necessarily cover it. I don't know how much you see that affecting or not affecting people that will come in, but when you do an x-ray on somebody, you talked about a herniated disc being the jelly coming out of the donut. Bulging disc, blown disc, these are terms that you hear all the time. You do an x-ray on somebody, how many people have something going on with their disc, say over the age of whatever, 40?
Well, most likely we do the MRI, not just the x-ray. That shows the discs a lot more, but you're going to see about 15, maybe 20% of the population have some kind of disc bulging, and they have no pain or problems whatsoever. So you're going to see a lot of abnormality on x-rays or MRIs, even when people who are asymptomatic or have no problems and have a good life. So when someone comes into the office and they do have that extra piece of evidence on film, I always say, this doesn't mean that this is causing your problem, what we see on this MRI or x-ray. We have to, start treatment. If we do treatment and you get better and everything, it's very possible that this is not causing your problem, that what we see on the x-ray or the MRI.
Really interesting.
Dr. Smith, what else do you do in your office that kind of makes you unique? What kind of things do you help people with on whether their blood work or whatever, do you specifically have a before and after success with?
We use blood work for nutrition, and that is one thing that has separated me very much so, is that, everyone is commented on maybe vitamins, they believe or don't believe in vitamins. I'm like, it has nothing to do with believing vitamins. I'm going to take the same blood work that your medical doctor is going to do for cholesterol or whatever else. I'm going to administer vitamins, garlic, niacin, fish oils at a specific dosage for you, and then retest you in a very short period of time, 4 to 6 weeks, 8 weeks later, to see that cholesterol coming down. If it comes down, it was because of those vitamins and those things, just like you would have gone on Lipitor. I always tell the patients so they can either start with my type of treatment, natural stuff, they can go to the medical doctor if they like. They just have to be aware of, hey, sometimes it may take a little bit longer with the natural stuff, not to be discouraged, but we do want to see change.
But then it's real. And you got the before and after blood work to prove it. Well, Dr. Smith, thank you so much for being on the show. We've so quickly run out of time. Remember, if you'd like to order a DVD of this show, just give us a call. Also, visit the Balanced Health page at tln.com for more information on this and other episodes. Well, coming up, stuffed peppers that pack a punch of nutritional goodness, and they taste great too. Stay tuned.